Thank you, Madam Chairwoman, and thank you, Congressman McGovern. Since the Supreme Court's unthinkable decision to overturn Roe v. Wade, women face countless attacks on our reproductive health care and desperately need Congress to act now. Despite an overwhelming majority of Americans supporting reproductive health care, 14 states have enacted total abortion bans, and many others have brought partial bans or restrictions. This is resulting in devastating consequences across this country. Millions of women are losing their right to critical life-saving care, and some states are actively attempting to stop emergency rooms from providing life-saving abortions and miscarriage care. But these bans do not just threaten the health and safety of women seeking abortions, they jeopardize all pregnant people. In states with abortion bans, we have seen maternal death rates increase by 300% compared to states without abortion protections. In states where abortions remain legal, like my home state in Colorado, people are facing longer wait times, delays in care, and a strained medical workforce. We've seen maternity wards even shut their doors because they can't navigate what might happen in this a medical emergency and how they would navigate the liability. In response to this assault on women's health care, Americans across 7 states, including my home state of Colorado, voted to protect access to reproductive health care in their state constitutions. Choosing how or when to start a family is one of the most personal decisions that somebody could make, and nobody should make that for you. These choices should be between women, their families, and their doctors. I'm a proud mother of a 4-year-old, and I'm also 27 weeks pregnant. While we are very excited to welcome our second boy, with every pregnancy comes so much uncertainty. And at our first appointment, I was told that I faced a high-risk pregnancy because of my age, and that the heartbeat wasn't where they wanted it to be. And so in a moment that should have been filled with joy and excitement, you're faced with anxiety. And I remember reminding myself that I am so lucky to live in Colorado because no matter what happened, I knew that I would be taken care of. I'm grateful that every single day, since then, every appointment and milestone I've had positive news. But far too many women are not as lucky, and they also don't have access to the critical care they need. Women across this country deserve more, which is why we must pass H.R. 12, the Women's Health Protection Act, to codify a woman's right to abortion federally.
The gentlelady, additional 1 minute.
The gentlewoman's recognized for 1 minute.
Thank you, Madam Chairwoman. I urge my colleagues to defeat the previous questions so we can bring up H.R. 12, the Women's Health Protection Act, because we cannot afford to wait and not address the urgent needs of women across the nation. I yield back.